Hello and welcome back. Today we're lucky to be joined by Dr. Meredith Lora, the new director of our internal medicine clerkship.
Good morning, Dr. Lora.
Hi, Dr. Akbashev.
So when I'm giving evaluations to my students, I feel like they're all pretty good, and I give them a 7, 8, or a 9. Is that what you're going for, or is that helpful at all?
In general, I would say that's not what we're going for, but I understand that feedback and evaluation is incredibly challenging. I think that's for a couple of different reasons. First of all, it's the people who need the feedback the most. It's uncomfortable giving constructive feedback, especially to learners who are struggling. I think what makes giving feedback and evaluating struggling learners challenging is that we're having to use these qualitative descriptors like not good, good, great, excellent. And you worry that it might change the learning climate for the negative. Additionally, sometimes we don't understand exactly what's the standard that we're measuring our learners against. So everybody just seems great. Or somebody might just seem like they're not doing well, but you're not sure why. So I think what I would challenge you to do, instead of giving qualitative descriptors like good, great, excellent for a learner, when you're giving them feedback or evaluating them, think about what actual skills you observed and describe those skills. Also, think about a learner in terms of their growth over time. Just like a child develops through various phases, we also expect a learner to develop through various phases as they grow. So Louis Pangaro in 1999 developed a framework called the RIME framework that basically describes learners as they grow and become great physicians. The RIME framework stands for reporter, interpreter, manager, and educator. So I'm going to take you through these various stages and then talk about how to use it. So a reporter is basically your third year medical student right when they enter the wards. A reporter can gather a great, reliable, accurate history, communicate well with the patient, and then present that information in an organized fashion without giving too much or too little information. Basically, they know what's important and unimportant. For example, in a heart failure patient, a reporter is going to understand the central problem of shortness of breath and leg swelling and appropriately examine the cardiopulmonary system and ask specifically about heart failure symptoms. And in a presentation, you're going to hear about that, and you're going to hear the presentation basically focused down to cardiopulmonary and heart failure symptoms and signs. So an interpreter takes the next step. An interpreter does everything a reporter just did, but now with all the data that they gathered, they can independently identify problems and prioritize them. And then that person's going to develop their own differential, be able to prioritize that, and now defend it with really strong rationale. So an example of that is that the person who just had a patient coming in with shortness of breath and leg swelling now may know to look for signs, listen for review of systems, and look for signs of pulmonary embolism on exam, or perhaps pulmonary hypertension, and they're going to report that. They're also going to come up with their own differential and be able to explain why they are looking for those things but why they think that heart failure is still the number one diagnosis. The next step after you become an interpreter is to become a manager. So what can a manager do? Just as you might expect from the name, a manager can now independently develop and defend a diagnostic plan and a therapeutic plan that is appropriate for the patient. They also might know when the next step of action needs to be taken, and they can kind of weigh the risk and benefit of different decisions to the patient's specific circumstances. So that person is going to understand whether or not afterload reduction needs to happen for that patient, how to appropriately diurese, or at least when diuresis needs to happen. But they also might understand that in this patient with CKD, the different measures that might need to be taken or how that's going to affect their plan. So we generally expect all of our third-year students to be a reporter in order to pass the clerkship. We hope students progress to the interpreter stage in order to kind of excel in the clerkship. And then the exceptional students, those few students that you're just crazy impressed with, those students are generally managing at least certain patients' problems. In contrast, a sub-I should start off running in the interpreter phase and hopefully progress to the manager skill set while they're in their sub-I. So lastly, which I want to focus on a little bit less, but the educator phase is the last stage in a learner's progress. And this encompasses basically how a senior resident can use evidence-based medicine and come up with specific clinical questions that they want to look up. They can scrutinize evidence and apply it to their patient. This is basically a senior resident and as an attending as they grow. So these are abstract concepts, so we understand that they're complex, and it might take a little while until you can apply it to each skill that we want learners to demonstrate, and also to apply it as they grow. So on the clerkship, we've developed a tip sheet, and this year I've taken the tip sheet and kind of applied it to the RIME framework to allow you to hopefully use this in practice. So as you can see, this is just an example of our tip sheet where we sort of map the learner through the pre-reporter, reporter, interpreter, and manager phases. We haven't included educators as we don't expect our third-year students to get there. And we've also kind of mapped it to the OASIS evaluation so that you can better figure out where that learner might score on their final evaluation. Lastly, I just leave you with this description. So this description is from one of our attendings, Tracy Vitesse, who uses this framework pretty readily to both give expectations, feedback, and evaluation for her students. And you can see just how clearly, just from reading this paragraph, this student performed well in medicine and kind of where they are and the clear next steps for their growth. Does that make sense?
Yeah, thank you very much. That's really helpful. So what I'm hearing is I need to be very careful and give specific feedback about what was good and what phase of learning each student is in.
Yeah, I think generally, if you can, whenever you're listening to a presentation or watching a student take a history, think about what they're doing. Try to, using maybe the tip sheet or a general RIME framework, try to put it into one of those categories. And then over time, you will naturally start to understand what tips to give them to get them to the next level.
Thank you so much for watching our video. I hope it was helpful. Please check out our other videos on the Department of Medicine YouTube channel. If you have suggestions for future videos, please leave a comment below.